Okay. See, we're filling up with attendees. Good morning, everyone. We're going to get started in just a minute. It looks like we are recording and good to go. My goodness. Thank you, Edward. Somebody's got a raise of hand. All right, well, the number's continuing to grow, but I think we're going to go ahead and get started because we've got a full agenda for today. So good morning, everyone. Welcome. I'm Amy Hewitt. I'm the Executive Director for the National Kidney Foundation, serving Northern California, Oregon, and Washington. Thank you so much for joining us today for today's patient panel, The Transplant Patient in a New COVID-19 World. Today's webinar is co-hosted by NKF Serving Northern California and CareDx. Before we get started, I just wanted to say a quick thank you to everyone who helped make today's session possible, from the moderator and panelists, our NKF staff, and our friends at CareDx, who all recognize the importance of addressing the needs of our community right now. And together, we were able to move quickly and be here at a time when you need us the most. It is my hope that you will leave us today informed and inspired. A few notes for today's session. We will be using the Q&A and polling features for Zoom. Both can be found at the bottom of your screen. So please submit any questions you have via the Q&A, and we will do our best to answer during the session. Please note we cannot provide any personal medical advice. Now I will turn things over to Sasha King, Chief Marketing Officer at CareDx. Thank you very much, Sasha, for your collaboration on this. As we were just discussing, this all came together so quickly, and I really am so grateful for your partnership. So thank you.
Amy, thank you. And I just want to first just welcome everybody in, and I am staggered to see now almost 280 people on this call. That's extremely touching. Just want to share, CareDx here, we're a company that is dedicated to transplant patient care, and so I'm so glad that we could have this opportunity to address the questions and needs and questions that are coming in from the transplant community and from the kidney community overall. There's a sign from a neighbor down the street from me that I saw this morning that said, "Separated but together." I thought that was such a perfect way to think about what we're doing here, as we all sit and you see us all in our own homes and different boxes, but while we are separated, this is our chance to come together, share best practices, and learn from each other and feel this sense of community. So I want to start off by thanking NKF and Amy, you in particular. I think the resources that National Kidney Foundation is putting out right now in response to COVID-19 has been exceptional. And Amy, for you, as somebody who's wanted to pull the community together, you've just done such a nice job of bringing us in. And for us at CareDx, I just want to share, in response again to COVID, we've also been mobilizing very fast on a couple of initiatives. We recently launched Remote Track, so you can have home blood draws for your standard tests, and something that we're happy to answer more questions about if anybody has them. And I'm excited to hear all the insights that we'll learn today from this group. I also get the special pleasure of getting to introduce our moderator, Dr. Vineeta Kumar. And Dr. Kumar is somebody who's truly exceptional. She's not only a very well-respected full professor and part of the transplant nephrology team at University of Alabama in Birmingham, UAB, but also somebody who's been an incredible advocate for the transplant patient community. I've just, in just the time that I've gotten to know Vineeta, blown away at her willingness to respond to patient needs, to hearing what are the insights that really can drive what we need to be doing. So without, again, further ado, I'll pass this over to Dr. Vineeta Kumar.
Thank you, Sasha. I loved your little separate but together analogy that sets the tone so beautifully for why we're here today. So 6 months ago, we hadn't heard about COVID SARS-2, we had not heard about coronavirus, and now the disease of COVID-19 caused by coronavirus has become a household name and has really taken over our lives. At a time like this, where it can be very stressful and overwhelming and scary, there are certain reflections I wanted to start by sharing. I've had this deep philosophy always that there's a deep awareness of the goodness of the human beings, that they're essentially kind and helpful and gentle, and that can give us all a lot of courage and hope. And on a personal level, now more than ever, this vision of our basic nature and multiple examples of it all around have really helped promote a greater sense of well-being and connectedness with each other. So I wanted to start by sharing this quote that we are waves of the same sea, leaves of the same tree, and flowers of the same garden. So separate, but together can help plan that better. Sasha, thank you. We want to make this very interactive. We want all our attendees to be part of this. You are muted, but your voice can be heard. One way to do it is through the chat function. So for those of you who are like me in the beginning, not as Zoom savvy, if you hover down to the bottom of your screen, you will see an icon that says chat. If you click on it, a box will open up, and then you want to make sure you've set that down arrow to all panelists and attendees so that whatever you write goes out to everybody. And let's do a quick exercise. Let's take a moment and pause and say, what's going on with us? What's in our heart right now? What's on our mind right now? And try and come up with that one word that you can describe how you're feeling. And I'm going to start off. I'm going to type my word into this chat box, and I'm going to send it to you all. So if everybody could try that. Fantastic. I'm seeing the words come through, and as we read them, all of us can identify with many of these themes. Thank you, everybody. Keep that chat function going. We'll be monitoring it throughout the hour. We also have a poll feature. Periodically through the hour, we're going to poll you. And when the poll question comes up, we would like you to answer that question. To get us started, we'd love to know who all are on the call right now. Please share your connection with the kidney community. Who are you? Are you a kidney patient, a family or a friend of a patient, a transplant recipient? Are you on the list for transplantation, a dialysis patient, a kidney donor, a medical professional? Another category that we have not put up here. So if you could take this poll and submit your answer, please.
I think we've got about 72% who've answered so far.
That should be good, Amy.
Okay, great.
Can we see the result of that, Amy? That poll?
There you go.
Fantastic. So almost a third of our attendees today are either transplant recipients or the family of the recipient, which is fabulous. And we're very grateful to our medical professionals who are also here. Clearly, they want to also share this with our patients and understand where our patients are coming from. So thank you, everybody. Now I get the very unique privilege of introducing our terrific panel of people that we have here today. Each one of them is a highly accomplished individual who does some amazing things in their day jobs, and they all also happen to be transplant recipients. The jobs they have in their daily life are things that I envy, and each one of them have made a career out of serving and giving back. And today they continue to do that. So without further ado, I would love to introduce fabulous Alex. So I'm going to turn this over to you, Alex Berrios. Please go ahead.
Hi, everybody. My name is Alex Berrios. Like Dr. Kumar said, I am a 13-year kidney transplant recipient. I currently work with the University of Kentucky, their transplant program as a patient advocate. And in that role, I work to serve and talk with patients and medical professionals in and around the region of Kentucky and the states that they border, and help to kind of help them understand the process of transplant, kind of who they're going to talk to, if it's the patient's perspective, help with the caregivers, kind of be that liaison between both the transplant patient or the prospective transplant patient, their dialysis center, and obviously the transplant center I work with. So I kind of help ease their mind, help them to know what they're going to kind of go through, and then kind of keep them abreast as to what's going on in their care as they do that. I'm currently involved with a few other things. I work with some organizations like the National Kidney Foundation as a kidney advocacy committee member, as a grassroots lobbyist. I work as an ambassador for the American Association of Kidney Patients. I've also been working recently with another organization called the IJ Nephropathy Foundation of America, and helping them to assist with education and awareness as well. And personally, I'm a father of 2 kiddos, a 9-year-old daughter and a 4-year-old son. So they keep me pretty busy now during this this pretty crazy time that we're kind of in right now. So yeah, that's kind of me in a nutshell. If you have any questions and want to know more, just feel free to reach out. Thanks again.
Thank you very much, Alex. Appreciate that and you being here. And now we go to our effervescent Elena Burns. Elena, the floor is to you now. I think you may be muted still.
There we are.
There you go. Thank you.
Hi, I'm Elena Burns. I am actually a kidney pancreas transplant recipient as of a little over a year ago. My journey actually started, I had type 1 diabetes for 37 years. So that led into me needing a kidney transplant, as well as I have a little bit of complicated family history. Unfortunately, my brother passed away from kidney disease in 2005. So with that came also me actually ultimately needing a kidney transplant. But with that, I've been very fortunate and my journey has been a pretty smooth transition. I had my transplant in Ohio, and I live in Las Vegas. So some of you who may have had transplants in different locations, and you are quite fully aware of some of the logistical issues. So that's been actually it's been a great journey for me. I could be more joyful and more happy about my progress thus far. And with that also, I actually am a clinical trials manager at CareDx. So I started at CareDx shortly after my kidney pancreas transplant. By shortly, it was probably around 6 weeks after my kidney transplant is when I started working at CareDx. And as you are aware with CareDx, we focus on actually assisting transplant recipients and identifying diagnostic tools, blood tests that will help identify rejection sooner in the process. So that is me in a nutshell.
Thank you, Elena. Thank you for everything you do. And now we'll go over to the incredibly service-oriented Mr. Derek Forfang. So Derek, the floor is yours, please.
Okay. Hi, I'm Derek Forfang. My kidneys failed about 22 years ago, and I've had 3 different transplants. One was a pancreas and had a kidney, and I have another kidney transplant now. And I spent about 9 years on dialysis and 3 years on PD, 9 years in center. And I am the National Kidney Foundation Public Policy Chairman. I also chair their Kidney Advocacy Committee. I'm on the board for Network 17 here in Northern California, and also serve on the board and the chair of the patient group for the forum of ESRD networks. And so a pleasure to be here today, especially with the folks we have on the panel. I know most of them and are friends with them, and they have valuable experiences to share. For me, I I travel quite a bit, normally about twice a month. So of course my wings are clipped now, but when I was in Seattle back in late January, I actually came home extremely ill. And it's before we were sheltering or told to do anything. And I thought I was very cautious, but actually had an upper respiratory infection. I was in bed for 4 days. I took antibiotics and recovered after a couple weeks. And they weren't doing any testing at the time, so I don't know if it was just the flu or if I had the virus. Then I went to a Medicare quality conference in Baltimore where I felt fine, but by the third day I spiked a fever and my respiratory symptoms came back. So when I got back from Baltimore, I started to shelter in place before we were told to shelter in place, because I just realized how dangerous it was for me to be out in the general population and flying and traveling. And unfortunately, I had a very close friend who was traveling with me in Baltimore who went to Las Vegas afterwards the following week and doing volunteer work representing kidney patients at a conference, and got an upper respiratory infection, ended up in the ICU on a ventilator, and unfortunately passed away. So this has become a real personal, as well as my work with the kidney community and seeing all the challenges going on. This has really hit home for me, and I just appreciate the opportunity to be on the panel today.
Wow, thank you, Derek. You made that feel really real and sharing that story about your close friend. So thank you for sharing that. And now we're going to go to Dr. David Gelfand, highly accomplished Dr. David Gelfand, who's going to share his journey. David, the floor is yours.
Good morning or good afternoon, all, depending on where you may be. I was diagnosed with advanced transitional cell carcinoma of my left kidney in November of 2009. About a month later, hand-assisted laparoscopic surgery to remove my kidney and ureter. A friend who was on the scientific advisory board at MD Anderson encouraged me to go there for a diagnostic workup because she knew they were doing lots of personalized therapy in medicine. Even though I had a complete sequence of my tumor and expression analysis of my tumor because of my prior work, all they wanted to do was heavy-duty adjuvant therapy, which I did not want to sustain for 10 weeks in Houston, Texas. So we came back and began heavy-duty adjuvant therapy at Mount Zion in March of 2010. One of the drugs, cisplatin, led to kidney disease, degenerative kidney disease, because cisplatin has a side effect of doing that. And in October of 2018 rather, my wife was my donor and had a kidney transplant again at CPMC. During the time in the ICU and in the hospital recovering, I read a whole lot of PDF scientific papers on the AlloSure test that my longtime friend and former colleague, Dr. John Sinitsky, who is CSO at CareDx, had sent me. I knew I wanted to start it as soon as possible. And indeed, in November 5th, I had my first blood draw for AlloSure test, 2.5 weeks post-transplant, because I wanted to see the high baseline and hopefully subsequent drop in donor. Switch, I then had one every month, and from then on, and with my last every month will be next Wednesday, and then we're starting every 2 months. The transplant and the follow-up, I am doing very well, fortunately, both by all the other markers as well as AlloSure testing. There are only 2 issues. Symptoms from the cisplatin cause peripheral neuropathy that have not eased at all. and the dramatic appearance of many squamous cell carcinoma lesions, necessitating first many visits to an excellent Mohs surgeon not too far from here, but early in the morning, and then switching a major immunosuppression drug in the hope of partially alleviating the marked increase in squamous cell carcinomas. I don't have time for all the other things, so that's it. Bye. Be well and
Thank
be
you,
careful.
David. Thank you, David, for sharing the depth of your story. And we look forward to hearing more from you. And then, last but not the least, Ms. Doris Liu, who has been another one who has really dedicated her life to educating the community and the patients about transplantation. So, Doris, would love to hear from you, your journey.
Yeah, thank you so much. You know, it's been kind of surreal, of course, right now, but also just in my life, because for many, many years, I was a piano teacher and I was staying at home and taking care of my kids. And so when I was diagnosed with kidney disease about 7 years ago, which happened after I was denied life insurance, kind of a twist of my life, I was diagnosed and knew nothing about kidney disease, did not run in my family. I learned everything I could. I found this organization called National Kidney Foundation along the way. I did a year of PD, peritoneal dialysis, which was a really great option for me. I feel like if people knew more about what PD entailed, more people would consider that. And so that's part of why I am working as a patient advocate, but also just to be out there to share my story. Because when I was sick, I remember feeling like what was missing, I had plenty of questions and all the clinical questions were answered, but I felt like that element of connecting with other patients, that the power of shared experience was missing. So that's partly why I'm here today, to share my story, but also to hear the experience of all the other people on the panel. So anyway, I was transplanted a couple of years ago. Next month will be my 4th year kidneyversary, and it's been fantastic. My kidney has done really well. I've had a few infections along the way, and I'm happy to talk about that if that comes up. But that's all about our immunosuppression and, of course, everything that's going on right now. So I have been connected with the NKF for a good 5 years, different patient panels. I've been with the patient advisory group at Kaiser up until recently. I'm with also, as Derek is, with Network 17, and also part of the NKF Kidney Advocacy Committee. And so I was really sad not to go to DC this year and continue our advocacy work, but we can do that from afar, as we are all finding. So I am now on staff, actually, since November with the NKF as Community Outreach Coordinator. And so it's been really good. So anyway, thanks for the opportunity to be here.
Wonderful. Thank you to all our fabulous panelists. And we're going to go back to each one of you and ask you specific questions as the hour unfolds. But to remind all of us, we're here today because we want to talk about this scary disease, the respiratory illness that's being caused, and other manifestations from this virus, and how we are coping with it, what impact it has had on us. And to get a sense of that, let's do our next poll question. And this poll question is about how concerned are you about your health when it comes specifically to COVID-19? So Amy, if we can get the question up, and there are 5 categories here. We'll give you a few seconds to review that and then pick your answer and then do your submission, please.
Let me know when you're ready to end, Dr. Kumar.
How many have answered by now, Amy? Or 50% at least?
We're at like 75%.
Beautiful. Let's go ahead and release the answer.
There you go.
I'm hoping everybody can see the screen for the answer, but for those of you who can't, 36% said they were extremely concerned, 32% said they were moderately concerned. So that takes us to almost most of the people who are attending. And then we have some who've said slightly concerned and somewhat concerned. So it's pretty evident the degree of concern here. And being a transplant patient, the impact of this is going to be even more heightened. So we'd like to start by asking this question of our panelists, that we've been impacted by the pandemic, the COVID-19 pandemic in some way, but being a transplant patient, how has that been different for you? And I would like to invite Doris to get us started on that. And then from Doris, we'll go to Derek. Thank you.
Yeah. So in some ways it looks a lot different, and in some ways it doesn't look all that different. I think as transplant patients, we all know we are immunocompromised. And so ever since I got my transplant, I've been always very careful about carrying disinfectant wipes with me everywhere, antibacterial gel, and wearing masks when I get on planes. I wipe everything down. So that has been the same. Of course, we've all had to adjust our lives somewhat. Well, not just somewhat, but a lot. Being home, my husband does all the grocery shopping. Last week, I got a little bit cabin fever, so I just needed to get out. So I went with him to the store, but I was not allowed to leave the car. And even before he got back into the car, he took off his gloves and discarded those. I have my meds at Costco, some of them, and so I had that delivered. So I am just being really careful. What's been nice also is that a lot of people have been reaching out to me knowing that I am a transplant patient, and so they have been very protective of me. The people in my office are telling me to not go anywhere, and when this all started, I actually made a trip down to the office just to get some last minute things, and there was a sign in the building, no access, building closed, and I'm looking through the glass doors and there are men in hazmat suits. So you know, I took that as another sign like, okay, I really do need to be careful. But as far as my medical care, I've been doing telehealth. I talked to my doctor, my primary care doctor, and had a visit with her. And so all those are being scheduled online and over the phone. And I've also had to ask a lot of questions to my transplant clinic. For example, how do I still continue my routine labs? Do I adjust my immunosuppressant medication? All of that. So I've been reaching out and getting some answers for those. And so I noticed lately that there's been a lot of webinars like this one and others that I've been tuning in to hear. What are the messages specific for transplant patients? So glad to be here, but also just to hear what other people are going through.
Doris, that's really gratifying to hear that you have a wonderful support system around you that's sort of made it their mission to protect you and care for you. And we're really glad for that. Yeah, thank you for sharing your insight. Yeah.
Thank you.
Derek, we would love to hear from you how the pandemic has impacted you, especially with all your respiratory illness.
Yeah, it of course has changed what I'm currently doing and probably what I'm going to do in the future. So, you know, normally I would go around, I was somewhat cautious, but probably not cautious enough. A lot of handshaking, not necessarily always having hand sanitizer on me. So those things will change in the future. But also been using telehealth and my portal to talk to my transplant team. With their guidance, we did have to slightly back off my immunosuppressives to get rid of the virus that I had. But then immediately, you know, as soon as I was starting to feel less symptomatic, brought those back because I definitely don't want to go into rejection. But all that was done over the phone. I did have labs at one point about a month ago while we were moving the immunosuppressives around. And because I actually, my prograph level was a little high anyway. So we backed off, and but when I got down to the lab, I realized they were doing COVID-19 testing in the same building. Even though I had a mask and gloves, it still was too much of a risk. I talked to my physician about it, and we've decided I've been pretty stable. This is 7 years into my transplant, and that we would go ahead and hold off for the next lab until possibly the end of this month, and then talk about it and see what's going on, because we don't want any added risk. So of course I'm interested in what CareDx is doing as far as labs at the house. I live with 5 adults, and so one of those has to work. They can't work from home. So they're coming and going. The others are going to the store. I haven't left the house in, oh my gosh, I've lost count, 6, 7 weeks, which makes me a little stir crazy, but I'm hanging in there. And but there's just a lot of worry when people come in and out. They're worried about making me sick. So there's a fairly high level of stress around that, and a lot of things my family's going through to make sure they don't get me infected. So a lot of hand sanitizer by the front door. You know, people are actually stripping down the one who has to work, and changing clothes before they come in. There's lots of things going on here. Wiping door handles and knobs down around the house daily. So some of those activities are, you know, they seem to be working. We're doing well, you know, but it's a lot of work actually, and a lot of stress.
Thank you for those comments, Derek. What's common between what you and Doris have talked about is the heightened awareness of things. We're all starting to see bugs where we didn't think they would be there before. Our transplant patients are particularly ahead of the curve in that they've always practiced that, but this has heightened it even more. You touched upon telemedicine and some of the other changes that have been happening around in the house. So very useful insights. And I'm seeing a lot of good things come up even on the chat. So please keep your thoughts going on the chat, because we want to come back and address some of those things also. Some of our panelists, Alex has a household member that's in healthcare, and we would like to talk a little bit about what plans have you made in case you or a family member gets ill. That's a scary thing for you to get ill or your family member to get ill and bring it back home. So we'd like to have Alex start us off there, and then we'll go to David next after that. So Alex,
Yeah,
please.
thanks, Dr. Kumar. So yeah, living in my household, I have a emergency room nurse practitioner and a licensed clinical social worker who both work in hospital settings. So what they've been having to do, kind of to touch on to what Derek had talked about, is they would take off. The plan is generally when they finish their shift, they'd go through our respective garage. We have a sink. They generally wash their hands. They remove, you know, their clothing, and they kind of avoid me when they know they'll call me and tell me, okay, we're going to be home in about 30 minutes. Try to stay away, you know, when we get home. So I, you know, you step away and do something different to be like 2 or 3 rooms away from them, or even onto a different level of the house while they kind of get themselves situated. So that's kind of a plan that they put in place for that. And, you know, if somebody has been sick, my family member who's a nurse practitioner was actually sick in late January, early February. And so she pretty much kind of quarantined herself for almost 10 days, just went to, and just kind of like completely kept everything, kept herself away from me, away from my son. She also, if she did have to ever come out, she kind of, you know, used hand sanitizer and wiped on all surfaces. And what, again, let me know, the plan was always to let me know if she was coming out so that I wouldn't catch it. And then in turn for myself, I was using hand sanitizer and washing my hands as often as I could shortly after she came from touching something or being around something. So that's kind of what I got.
Okay. Thank you, Alex, for sharing the things that are being done when the caregiver re-enters the home again and keeps you safe. Yeah. David, we would love to hear from you what plans you've made in case you get sick or a family member gets sick, God forbid. But
Thank you very much. In our home, there are only two people, myself and my wife. I am almost 76 and she's about to be 73. So first thing I did was to find out where I can have either of my nephrologists or my primary care physician send a sample for the Roche SARS-CoV-2 assay. Having been very familiar with, unfortunately, the CDC assay, I know what makes good PCR and what makes bad PCR. So we found that out at the various places in the Bay Area that do it and places that don't run it, and we've advised all our friends. So at the first sign of any disease, my wife or I will get the Roche CoV-2 diagnostic assay. I've also found out that we each would qualify for compassionate use of the Gilead drug that's being administered under compassionate use clinical trial, both at UCSF and UC Davis. Since I'm a former faculty member at UCSF, we will go there and hope for the best. We are taking extraordinary precautions. My wife does all the shopping, I do none. Friends drop off shopping on our porch and then leave and we pick it up. That's it. So we exercise as much as we can, even though the gym is closed. My wife does yoga and I do yoga daily. She by Zoom, me just myself. We do walks and stuff like that, hoping to stay healthy. And so far, oh, one last thing. Every morning and every night we sniff a can of cinnamon to be sure our sense of smell is as strong as previously. That we understand 24 to 36 hours before any other symptoms appear, you may lose your sense of smell and taste or taste if you have good sense of smell and sense of taste. That's it.
so David, you've sort of kind of really researched the field and prepared for the contingency of getting sick and what kind of therapies could be available to you, but also you've touched on what you can do to prevent yourself from getting ill, which is what Alex was also talking about.
Yes.
There might be other things that people in the audience have thought about that hasn't been said. So if you have, please go ahead and use the chat box for it. I'm seeing Annie Pugh say that the Gilead trial is closed now and we can explore that further. I'm hearing something about cinnamon tea. And then each one of you on the panel have had somebody say something about appreciating you for sharing your story. So the panelists keep that coming. So as we're sort of reflecting on this and talking about the stress and the fear and things you're doing to take care of yourself, we would also like to address how are you reducing stress and maintaining mental health? What tips can you share with everybody? This is one that we would really also like the audience to also put in their ways of coping during this stressful time. And we will get started with this question about what tips can you share? What are you doing in your own personal life right now? We'll get started with Elena for that. Thank you, Elena.
Thank you. So I am a firm believer in mental health. I'm a former college athlete, former college basketball player. So I learned a long time ago that your mental health and how you view things actually can impact your outcomes. So for me, it is always like, I never think of anything the negative of the situation. You know, being a transplant patient, you of course know that there is the risk of rejection. There's multiple risks and everything that's involved that are inherent to having a transplant. However, that is not in the forefront of my mind ever, you know, so that is not one thing that I focus on. I am one of those people that during my stress, when I'm feeling stressed, especially, let's be honest, there's an inherent stress of being a transplant recipient. And then we add on the COVID-19, which is, it's basically an enemy that you're fighting that you can't see. So, so that's also a stressor because you want to see who your opponent may potentially be essentially, but with this, we can't. So for me, with the mental, like for my mental health and reducing stress, I firmly believe in exercise. So no shameless plug to Peloton, but I believe in Peloton is like a great outlet for me, which was my morning. Also this morning is a great outlet, as well as, I believe in also opening like your shades, right? Like opening even a small thing, opening your shades and like opening, letting in some light, like I feel like that makes a big difference in how I view things. And even going out for walks, I'm not saying within close to anyone, but obviously keeping your social distance, but also like going for walks and like, and I will admit, I am guilty of sometimes like saying, hey, Google, play music and having a spontaneous dance party in my kitchen. So I firmly believe that it's important to also and how you view this and how you just make sure and take care of you and do what's best for you.
Thank you, Elena. Your joy for life comes through so beautifully. And I'm reading some wonderful things that our panelists, our attendees are sharing. Katie says yoga helps a lot. Carl Fuller says mindfulness. Ryan says running. Exercise and staying connected is what Angela says. Again, yoga and meditation is what Carrie says. Mindfulness again. Taking walks helps me calm down, or doing gardening, says Donna. Fantastic. So keep these coming. Prayer, says Melanie Guzzo. Listening to music, talking with friends and family, exercising, says Barb. Every morning before I leave for the hospital and every night when I return, I sniff deodorant to check my sense of smell, take my temp, sort of self-checks, absolutely. Amy says I journal, exercise, FaceTime. Fantastic. I wish I could keep going on, but these are all available for everybody to look at. And our panelists would also like to share some other things they're doing. So I would like to turn this over to Alex and then Doris to share your own few tips of what you're doing.
Thanks again. So for me, generally, a lot of what the panel, what you just kind of mentioned, Dr. Kumar, music for me has been a great one. Taking those walks in the park, kind of doing some hiking. Obviously, keeping social distance is important. For me, it's been music. It's been walking. It's been getting the vitamin D, getting out and opening up those windows, getting that fresh air, really make a difference and kind of helping to just kind of step away from being just kind of locked up in a home or your room all day and just being able to kind of get out. So those are the big ones for me. Music and definitely taking a walk have been really good to kind of step away and not have to think about, listening to news or listening to just, all the different reports that are going on. So it's been really beneficial to listen to some like just peaceful music of all sorts. I mean, it's just what I enjoy to do. So it helps to kind of ease the mind, calm the mind. And then also kind of to think about it is some tips, I think, for me. I kind of do some journaling as well. Gratitude journal has been helpful to remember that, like, even under these circumstances that we're under and in, it might be tough, but to just still, wake up each morning and to kind of write or say a prayer or say some kind of mantra to yourself to know that, it's important to be appreciative of what we do have in front of us, and that we do, even as transplant recipients, go through a lot, that we ultimately have a life and that we can, live it the best way we can.
Beautiful, Alex. Ultimately, we all have a life, and you're talking about connecting with the outside world by opening up the window, connecting with your own self through journaling, and then reaching out to your things that give you joy. Music happens to be for you. And Elena alluded to something similar. And so are a lot of these comments coming up here. On a lighter note, Gerardo says, playing guitar and karaoke. So it looks like, Elena, you might have a partner with your dance party for somebody who's going to do that on the other end. Doris, we would also like to hear from you, and then we're going to go to a poll question after that.
Yeah. So definitely walking with friends. And it's odd because, I used to try to get together with friends to walk, and it just kind of didn't occur to me, well, if I can't physically get together, I can still do that. So we've been much more intentional about just making these phone appointments and then walking together wherever we are. Another one a friend told me about was there's a lot of churches, you know, are doing online service. Menlo Church had a conversation with Condoleezza Rice. And so Dr. Rice actually shared a lot about this whole experience and what it was like for her during 9/11 and the similarities and how it is, you know, being grateful. So your gratitude journal is definitely helpful. Your faith, whatever it is that you find to anchor you, that's really important. And so I highly recommend that. This week was my birthday. I had a friend who left a little package on my front porch, and I opened it and there was toilet paper and some hand sanitizer and also some wipes and masks. So I just felt like, oh my gosh, I texted her like, this is worth more than diamonds. This is great. So, you know, just the connecting with friends and feeling loved. We've had potlucks over Zoom meetings. I have this quarterly potluck we get together and there's always a theme. And so the theme this time was make what you've got. And so just be creative and go into your pantry and create something. So, you know, Kahoot has been another great game that we've been able to just connect with friends. So that's been a huge part for me. So those are some ways, yeah.
Thank you, Doris. You're sort of resonating with some of the comments on the chat box right now. It says virtual coffee and happy hour, trying new recipes. That's what Megan Sweet says. Donna says sitting in the sunlight by the pool or floating on a floaty. A couple other people have had virtual birthday parties, just like you, Doris. Happy birthday.
Thank
fellow
you.
Aries. Yeah, absolutely.
Yeah, can I just add one thing? Everybody should get onto the John Krasinski SGN, Some Good News. It's just good news of what good people are doing in this world across the globe during the COVID crisis. So good people out there.
Thank you. Thank you, guys. I wish we could get all the panelists to chime in, but we have more questions. And to keep the hour running, would like to do our next poll question and ask, a lot of you have already volunteered this information in the chat, but we'd like to sort of get a general sense of what are the most common ways you're doing it. So Amy, if you could bring up the poll question about how are you maintaining your social support system while observing the social distancing? So there's a physical distancing, but we've said that doesn't necessarily mean we have to distance each other so truly connectedness and emotionally. So what are some of the things you're doing? If you could look at that poll question and answer some of this. Amy, when we get to about 50%, let me know, please.
Okay, we are there.
Oh, fantastic. Can we show the results of the poll?
Sure. Hopefully you can see it. I'm having a little trouble controlling my screen, but.
Yes, we can see it.
Okay,
Thank
good.
you. Yeah. So, wow, look at that. Connecting virtually with friends and family is a quarter of our group. 72% said that. And then online support group is another 8. So about 80% of the people, again, virtual hangouts with spiritual and social groups. You take all that virtual together, that's about 100% of the group here that's reaching out in some way or the other. 2/3 are talking about getting outdoors, which is fantastic if you're allowed and you have that option. Social media has been an outlet, and I'm so glad to note that there's a very small percent that says that I'm still looking for ways to connect. So us all coming together even today is an expression of us wanting to connect with each other. And this makes this hour so much richer. So thank you again for that participation. So since we've talked about this virtual connectedness, this kind of goes hand in hand with our next question. We would like to know from our panelists and then also our group in the chat box. And by the way, a ton of people have posted the SGN YouTube website for those people who didn't know what Doris was talking about. So there you go. So here, the chat's working beautifully. All right, so we want to know from our panelists how you're working with your medical care team right now. Has it been more or less difficult for you to stay in touch with your medical care team? Has your provider converted your clinic visits to phone or video telemedicine, which most of you said that you're doing telemedicine, and how has that experience been? And we would really like to focus more importantly on, do you want this to continue in the future, or would you like to go back to the way things were? If you want to continue, why? If you want to go back to the way things were, why? We would love to hear both of those. So for this, let's get Derek let's go to you, Derek, to see if you could get us started about what you like about now that you would like to keep, and what would you like to continue, not keep and go back to the way things were.
Yeah, I think it's been pretty valuable to check in. I did that a lot with my transplant team anyway. You know, just sending messages and quick calls on the phone. But I think it's really valuable. I have, like for my endocrinology team, I'm on an insulin pump, and according to Medicare, to get my supplies, I have to meet with them every 90 days. It's a lot because I don't have that many drastic changes, so it'd be great to use telehealth to do some of those meetings and maybe meet once or twice a year instead of quarterly. So I can see where it would add value. And also there's just times, especially during the flu season, that I'm not so excited about being in a hospital setting anymore. So I think it would be great at certain times of the year to, you know, be able to have those things happen. I know right now one of the issues for me is my medical team is just really busy. So sometimes it takes a little longer to get back to me. But I'm not talking about emergency issues, so it's okay. But I see a lot of value in it, and you know, I think it should change how the flexibilities we have in the future should stay there. And I'm hoping that Medicare and some of the other insurance providers, you know, are paying attention and will listen to patients afterwards to really get feedback from us on what we've learned.
Absolutely. Derek, you're saying that it's hard enough being a patient and then adding inconvenience to getting your own care. This pandemic has kind of allowed us the idea of telemedicine and sort of easing some of that difficulty in accessing your team, if you will. So thank you for sharing a lot of those thoughts. I would like to give each of our panelists 10 seconds to just sort of say what you would like to take forward or what you would like to keep the same. So Elena, can we start with you, and then we'll go to Doris, and then Alex, and then David.
So as I mentioned earlier, I had my transplant, you know, about 3,000 miles away from me where I'm located. So I actually use a lot of telemedicine right now. So, you know, for me, that's my norm, almost post-transplant, probably for about, I stayed in the area for up to 4 months. So after that 4-month time point, I've been mostly all remote, you know, and of course, I've been in contact with my team, via text messages. I'm probably one of those higher maintenance transplant participants, but also via text messages and emails and phone calls if need be. So, so with that, I'm fine with how I'm avoiding hospitals. So I would like that definitely, I'm fine with that continuing. And also, I think when we were talking before at the handshakes, I will say I am one of those people that carry hand sanitizer, like small things of hand sanitizer, all the time with me. So each time when someone shakes my hand, I always feel bad, but as soon as they shake my hand, I pull out my hand sanitizer and I wash my hands immediately. That's including doctors. So I don't discriminate in that way. So I would actually like for handshakes to discontinue.
Yeah, you used an expression, Purell the handshake away, right?
Yes.
And there's a comment in the chat box about using telehealth from Amy saying, such a valuable tool. It's sad that it's taken this pandemic to move this tool to the forefront. I will advocate to keep the service going. Thank you, Amy, and then all the other comments. Doris? How about you?
Yeah, well, second to the handshaking for sure. You know, in fact, I have been wishing this, but saying to myself for the past 4 years since my transplant, like this would never happen because it's so ingrained in our culture. But I would really love for the handshakes to go away because really that's like, you know, if it were part of our standard way of greeting already and we had to invent a way of greeting that maximizes the spread of germs, I think handshaking would be it. So it would be great if that goes away. The other thing is I would just love for us to keep on being creative to connect, like all the things that, you know, whether it's walking by phone or meeting by Zoom in ways that you know, even after we physically connect, we can still connect with people who are far away.
Yeah, Doris, Elena, Doris, you've got some compadres in the Zoom webinar chat that say no more handshaking. Lisa Simpson says that. And as a caregiver, I would never have thought that this would be such a bad thing. So thank you for sharing that insight. That it's scary as a patient when you don't know where your doctor's hands have been, right? So thank you for that. And somebody else said that they would absolutely take forward the connectivity with their family, friends, and neighbors and want to keep that going. You know, I just glanced at the hour and we're 5 minutes to being done. I mean, we've been together an hour. How has this time absolutely flown by? I would like to get our audience to do this next poll, and the comments that are coming through are fantastic. So thank you guys for using this web chat. It says, being a Trekkie, I like the welcome. Live long and prosper, hand thing, like that sign, right? Fellow Trekkie. All right, so let's do poll question 3. In terms of your health and medical care, what would you like to see as we move out of this crisis? So these are your options. Some things that you've used, some you haven't been made available to, but what would you like to see going forward as we move out of this crisis? Amy, when we get to about 50, 75%, we can.
Okay, we're just approaching 50. All right. There you go.
Fantastic. So looks like the winner is telehealth option with at least a third of the group wanting that. A very important thing, availability of 90-day medication supply, absolutely, in case you can't get to your pharmacist. The in-home lab service is almost a fifth of the people have said that. So go CareDx for what you're doing. Social distancing practices, no handshaking, that again shows up. And increased awareness around what it means to be immune suppressed. So it sounds like the pandemic has particularly made us aware of what we need to do to stay ahead of this curve. And so I think since we're getting very close to the hour, we have a couple of minutes left. I wanted to take a moment and say that clearly we could keep going another hour. This still seems like there is a need to keep talking about it, engaging, talking, sharing. We're going to look at all the comments that have come through in the chat box. And if there was something that was unanswered, we will definitely get back to everybody on that. And with that, Amy, I'd like to turn it over to you and Sasha and Rana so that you can close us out. I started the hour by saying I'm deeply grateful. That was my word. I'd love for all of you to reflect back on what word you picked and see how this hour has amended or kept that word same. For me, I continue to be deeply grateful because it's because of you, our patients, that we are here and we have a role. So thank you. And thank you to our amazing panelists.
Yes, thank you so much. And I apologize. It looked like maybe you could have only chosen one on the last question. So please continue to fill in the chat if there's any other options that are interesting and you want to consider. I'm sharing this slide right now. Just these are a list of resources that we will make sure everybody has access to after this call. And then I really just want to thank everybody. Dr. Kumar, thank you so much for being such a wonderful, wonderful moderator. And all of our panelists, yes, we were all saying before the call that you could be a therapist, and we would all want to connect with you weekly. So thank you so much. I also want to thank all the panelists. As I mentioned, each one of you are very special and near and dear to my heart. So thank you for giving of yourself. I want to thank our friends at CareDx, Sasha, Rana, all of you for activating so quickly and making this happen. We are forever grateful, and I hope you all enjoyed this. Really just appreciate all of the enthusiasm around this project. So thank you. Sasha, do you want to add anything? We might be getting good and ready to wrap up. So I will follow this. I know there are some of the questions that we did not get to. I will make every attempt to answer them if we can, if they're not personal medical questions, and circulate back to each of the attendees so we can make sure we get your questions answered.
Amy, can we get all the panelists to just stay back for a moment so we can debrief afterwards, and we can otherwise stop the recording when we're done?
Of course.
And thank you, everybody. Again, have a good weekend. Health, safety to all. Much love and care.
Thank you. And yes, the recording will be available.
Same back to you and everyone else.
Thank you, everyone.
Stay healthy.
Yes, absolutely. Stay healthy.
For certain.
Take
Great
good care.
meeting you people.
Okay, you too.